Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
When people first hear about TMS therapy, they usually have one big question in the back of their mind. What is this actually going to feel like? And honestly, that question makes sense. A lot of people starting TMS have already been through multiple forms of depression treatment. Some have tried medication after medication. Others have spent years in therapy, doing everything they were supposed to do, and still waking up exhausted, emotionally flat, or stuck in the same mental loops. So, by the time someone finally sits down for their first TMS session, there's usually this strange combination of hope and hesitation. Some of them want to believe this could finally help. Another part is trying not to get disappointed again, and that emotional mix is incredibly normal. The first few sessions. One of the most important things to understand about TMS is that the early stages are usually subtle. This is not the kind of psychiatric treatment where people suddenly walk out after one session feeling transformed. For most patients, the beginning feels quiet, sometimes almost anticlimactic. The first few sessions are really about calibration. You sit in a reclining chair while a magnetic coil is positioned against a specific part of your scalp. Then the machine begins delivering magnetic pulses to targeted brain regions involved in mood regulation. Most people describe the sensation as a tapping or knocking feeling on the side of the head. You also hear a clicking sound that stays in rhythm with the pulses. At first, it feels unusual, but the brain adapts surprisingly quickly. Clinicians usually begin at a lower intensity and gradually increase it to the appropriate therapeutic level. The goal is effectiveness without overwhelming discomfort. Some patients experience mild headaches or scalp tenderness during those first few days. That's one of the most common early side effects. Fortunately, it tends to fade as the scalp and nervous system adjust. Unlike older brain stimulation treatments, TMS is sometimes imagined to require no sedation or downtime. You stay awake the entire time. Sessions typically last about 20 minutes, and afterward, most people simply go back to work, drive home, or continue their day as usual. Early emotional changes. What patients really want to know, though, is when emotional changes begin. That's where expectations become important. Some people notice tiny shifts within the first 1 to 2 weeks of treatment. Not dramatic breakthroughs, more like subtle cracks in the depression beginning to loosen. Maybe they sleep through the night for the first time in months. Maybe getting out of bed feels slightly less impossible. Maybe the constant negative thought loop loses a little intensity. Some patients describe it as the emotional volume lowering just enough to breathe again. But many patients notice absolutely nothing at first. And that's important to say clearly, because lack of immediate change does not mean TMS is failing. The neural pathways involved in depression often become deeply entrenched over time. TMS works by repeatedly stimulating underactive regions of the brain and gradually encouraging healthier communication patterns between those networks. That process takes repetition. It's closer to physical rehabilitation than flipping a switch. How clinicians track progress. Clinicians know this, which is why they monitor progress carefully throughout treatment. rather than relying solely on how someone feels day to day. One of the most commonly used tools is the PHQ-9 questionnaire. It measures factors such as mood, sleep, energy, concentration, hopelessness, and loss of interest. What's interesting is that clinicians are not just looking at the total score. They're looking at patterns underneath the score. Maybe someone still feels depressed overall, but their hopelessness rating improves slightly. Maybe sleep improves before motivation does. Those small changes matter because they often signal that the brain is beginning to respond before the patient consciously feels a major emotional shift. And if there is absolutely no movement after a substantial number of sessions, providers can adjust factors such as coil placement or stimulation intensity. TMS is not a rigid process. Good psychiatric treatment evolves based on the patient's response. TMS as part of a bigger treatment plan. Another thing patients sometimes misunderstands is that TMS rarely exists in isolation. Most people continue therapy while receiving TMS. Many stay on medication during treatment as well. And honestly, that combination often works best. TMS may help improve the brain's functional wiring and mood regulation, while therapy helps address the thinking patterns, emotional habits, and behavioral cycles that developed around the depression over time. For some patients, TMS becomes one piece of a broader mental health strategy that could also include approaches like ketamine therapy later on if needed. The important thing is that treatment becomes personalized instead of one size fits all. What the research shows. One of the most reassuring findings for patients comes from large real-world outcome studies. A major review involving over 5,000 patients found TMS response rates ranging from 58% to 83%, and remission rates from 28% to 62% after completing treatment. Those are strong numbers, especially for people dealing with treatment-resistant depression. But here's the key. Those improvements are typically measured after completing the full treatment course, not after week 1. Most TMS protocols involve daily sessions over 4 to 6 weeks. That timeline exists for a reason. The cumulative effect matters. So, if someone is sitting in week 2 wondering whether it's working, the answer is often, it may already be working underneath the surface before you fully feel it yet. That's one of the hardest parts emotionally. Healing through TMS requires patience in a world that wants immediate results. At Zeam Health Wellness, we try to help patients understand that process from the beginning so they don't interpret normal early uncertainty as failure. We track symptoms carefully, monitor progress closely, and integrate TMS into a broader psychiatric treatment plan that adapts over time, because depression recovery is rarely linear. Sometimes improvement begins quietly. A better night of sleep, a little less heaviness, one small moment where the future doesn't feel impossible. And sometimes those tiny shifts are the first signs that the brain is finally beginning to heal. That's it for today's episode. If you've been considering TMS therapy or simply want to learn more about advanced depression treatment options, reach out to Zeam Health Wellness in Sacramento, Folsom, or Roseville. And next episode, we'll explore how Spravato fits into modern psychiatric treatment plans. We'll talk about where Spravato fits into depression care today, how it differs from traditional antidepressants, who it's designed for, and what patients can realistically expect from the treatment process. Thanks for listening, and we'll see you next time.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.